G'day, Chris from the Headache and Pain Management Centre here with another myth to be smashed about chronic pain. And today we are talking about one of the biggest myths out there about long-term persistent chronic pain, and that is that there must be tissue damage in order for there to be pain. Now, this is a really, really big myth, and it's the biggest one out there, that we can either inject something, we can jab something, we can surgery something, we can do something to fix all the pain. But that's a big myth. That is not the way that it works. And today I'd like to explain to you how we can actually solve this chronic pain, or at the very least make it much more manageable, when you can actually realize that there doesn't need to be tissue damage to cause all of this pain. I want you to bear with me. It's a pretty heavy topic, but by the end of the video, you will have a good understanding about how this all actually works. Now, for the last 15 years, there's been a lot of research coming into the field of pain. I'm going to tell you a bit of a story from back in the 60s about how this all came to pass. Now, there was a guy on a work site, I think he was in London, England maybe, about 50 years ago. Okay, he was on a work site, he was a construction worker. And what he did is he shot a nail right through his boot. Okay, he must have been knuckling around with his mates or something, but somehow a nail went right through his boot, and he's like, ah! Huge amount of pain. Okay, so he was in a 9.5 out of 10 pain. He's screaming with pain. They called the ambulance. They've put the green stick in and they've gone, okay, this guy, he's obviously put his nail right through his foot. No wonder this is going to be really sore. So they got this guy to the hospital, and what they did is they thought, well, his boot's there, we don't want to cut the boot just in case we do some damage to his foot, so we'll take an x-ray to see where this nail has actually gone through his foot. So they took the x-ray, and again, this is an hour and a half after he's had the accident. The nail's still in there, he's still in crippling amounts of pain, and what they've done is they've taken the x-ray and they've found the nail actually went straight through the middle. It went through the middle, that little gap between the big toe and the second toe. So there was absolutely no tissue damage at all. But there was a 9.5 out of 10 pain, which was real. It was as real as he was there, right? He needed the green stick, he was in agony. And that was the first time where a researcher went, that's weird, what's going on with that? And that was actually the starting point of all of this research that I'm going to talk about today. That is, you can actually have no tissue damage at all and have enormous amounts of pain. And on the flip side, you can have enormous tissue damage and not have a lot of pain at all. So what's going on here? How can we actually work through all of this? Well, let's think about it. So when you have acute pain, like a really obvious tissue injury, like I've severed a finger or I've broken an arm or something like that, obviously you're going to have a bit of pain with that, okay, because there's actual real tissue damage. Probably the context by which you've injured yourself predisposes your brain to thinking, yep, this is pretty dangerous. So there's a huge pain response that comes with that. Now, obviously, pain of that type is really useful, because if you keep doing the activity when you've got a lot of pain, you're going to do more damage. The last thing that you want to do is to be running around with a broken arm, because you might do more damage to nerves, you might do more damage, you might even have blood flow lost to your hand, you might have some sort of really nasty issue if you don't get attention straight away. So that's the purpose of having acute pain there. But when pain lasts for any more than, say, 3 months, there's actual physical changes that happen to your nervous system and your brain that makes the pain persist even when the tissues have healed as well as they possibly can. So, for example, there's a patient that I'm seeing at the moment who injured his neck about 12 to 18 months ago. And this guy's a pretty fit, athletic guy. He must have hurt himself at the gym, we think, if we put all the pieces together. And basically, all of the scans have come back clear. There's nothing that's acute there that's causing this really nasty pain. But what's happened over time, because the pain was so acute and it's stopping him from going to work, he's still on work cover, he's not able to do his full duties, is that his brain has actually persisted the pain in the absence of any tissue damage there. And you go, well, what could be causing that? What happens when you have pain for a long period of time is that your brain starts to protect movement that it thinks might be dangerous, even if there's no tissue damage there. So for example, after a whiplash injury, what can often happen is that you can have a bit of, a few muscle strains or anything immediately afterwards, but if you then don't move properly through the rehab process, if you don't sort of gently move your neck going through, then it can actually get stuck into a pattern where your brain believes that moving the neck is really dangerous, when in actual fact, it's not. It's almost like the brain preempts that there's going to be something wrong before there is actually something wrong, when there is actually nothing wrong. Well, you might even find that this happens if you've got persistent pain, and this actually explains a lot if you've got this. That if you've got persistent pain where some days it feels really, really good, and other days it feels really, really bad, and there's nothing that's changed between one day and the next. This can actually be as a result of your brain cranking up the sensitivity in the absence of any tissue damage. Particularly if you've had MRI scans, you've had all the scans, you've had all the tests, and there's nothing that they can put it down to. So tissue damage and pain, they're not related. It's actually more to do with the way that your brain, your nervous systems, and the signals are coming into your brain rather than the tissue damage itself. So when I talk about this with patients that have chronic pain, that have real issues that they haven't got sorted over a number of years, what we're actually talking about is more a pain problem than a tissue problem. When I talk about a pain problem, what I'm talking about is the way that the nerve signals are being sent up through your spinal cord into your brain and how your brain is interpreting those signals coming in. So often retraining the brain with mirrors, with imaginary movements, with gentle movement, with education is the best way to go to solve these really mysterious chronic pain issues. And it's amazing how often the brain can actually play tricks on us, giving us pain when we don't need it. So the biggest myth for today is that you have to have tissue damage to have pain. That is an absolute furphy. You don't need to have any tissue damage at all to have really, really severe pain. Just in the other way that you can have severe tissue damage and no pain. Say for example, someone that's had a really big tumor in their chest and they don't know about it until they get the scan, or someone in a battlefield who's just been shot through the leg who's able to run away from the enemy before they feel anything that's actually happened. So it can happen either way. But when you have long-term chronic pain issues, I want you to stop obsessing about whether or not there's something that can be fixed or something that can be scanned or something that can be operated on, because a lot of the time they would have found it by now if you haven't actually had the treatment. What the biggest issue is the way that your brain interprets the signals and actually being able to change those signals so your brain is less fearful, less scared, less apprehensive about moving the injured part and giving you pain as a result of that. Pain and tissue damage aren't related. They're actually more to do with the way that the brain interprets the signals as we're talking about chronic pain. I hope that's been really helpful today. It is National Pain Week. We are talking about the myths of chronic pain this week, and tomorrow we'll be talking about another myth. So please stay tuned for that. Any questions, comments, please type in below and we'll get back to you there. I hope that's been useful. We'll see you again tomorrow. Cheers and bye for now.